Hello, so today I will be speaking on a recent encounter that I had with one of my patients in clinicals. This particular patient is a patient with a diagnosis of alcohol use disorder, as well as battling other types of diagnoses, mental health diagnoses, as well as anxiety and depression. During the individual therapy session, the patient expressed how they were battling their struggle with trying to get over their sobriety and having so many failed attempts at sobriety. But they did express that they had a desire to gain control over their own life and be able to make the decision to not drink on their own without having to use so many different skills and so many different things they've learned in therapy. They just want to have that power and that control. The interaction was very significant. I feel like it was very helpful for me because I don't think prior to this clinical rotation I understood the challenges that these patients actually face with the recurrence of relapse and them having to face criticism from others and dealing with the family, and how sometimes they even have a hard time having a support system because they failed sobriety so many times. Um, the impact on understanding the PMHNP role and the provider relationship. I feel like that is a very deep conversation because understanding the role in managing substance use disorders and people that have the co-occurring like mental health disorders is very, very challenging and very deep. Working with these patients showed the importance of a lot of things that go on with addiction because I didn't quite understand that they have so many other diagnoses related to the addiction because of all of the different things that it takes them through. Like when you are trying to get over a specific substance, a lot of times they end up depressed because they're not able to get over it as quick as they thought they would. And also, the substance a lot of times can cause them to feel depression as well as anxiety when they're trying to get over it and when they're craving it. So I feel like that was very significant as well. I do understand that this type of job and working with this type of patients definitely requires you to be able to express empathy and have patience and have a structured treatment plan. It's very important that they have a structured treatment plan so they would have a positive guide to follow. Building rapport with your patients is very important as well, and it's nothing that can happen overnight. It takes time, so that is also very important with the role of the PMHNP. The experience so far has been great. It's a learning experience. I can't wait to continue to see what happens week by week. When it comes to personal strengths and limitations, I do feel like I personally had the strength of active listening because even in any type of mental health field or any type of patients you work with, you have to actively listen to them to understand them in order to help them. And I do feel like I was also able to show empathy. Some of the limitations I would say is because I didn't understand exactly how challenging these diagnoses were at first. I guess understanding how relapsing is so easy for them and how you have to support them and have to also find ways to help them find those people around them that can support them they may not even know can, because sometimes the support system could be someone as simple as one of your children, it could be one of your parents, it could be a coworker, just anybody that wants to see you do great and help you along the way. I didn't realize it was that challenging. I really didn't. I know I've heard a lot of stories over the years about people who were addicts, but to actually talk to them and see how people are really hurting because it's hard for them to stop, that definitely is something that made me look at the situation different and look at these patients different. When reflecting on therapeutic use of self, um, I used a compassionate, non directive approach, and I allowed my patients to express their fears as well as their frustrations without interrupting them. It's also very important. By using motivational interviewing techniques, I was able to encourage the patient to, I would say, articulate their own reasons for seeking change because we all have reasons that come in different ways. Like on a medical level, we may be talking about their health and things that are better for them to be able to be healthy. But for that patient, it can be a deeper conversation that they can express why they need to stop whatever substance they're abusing and the reasons why they feel like it's better for them to stop. This experience has been, like I said, a learning experience so far, and the importance of being present for that patient, particularly with those who have already been feeling like they've been defeated by their disorder. It's important for us just to be there for them and to understand them, to listen to them, and again, be empathetic. With specific learning and insight, future application, reflecting on this particular encounter, I learned that the value of adapting a non-judgmental stance is very important, of course. You got to be able to make the patient feel like you're listening, but you're not judging, because that helps them with their recovery journey. And also, the patient interaction taught me the importance of viewing relapses as learning experiences rather than an actual setback, you know. And it's essential for building resilience in patients with alcohol use disorder. Very, very important. In future practice, I will focus on strengthening my tolerance for maintaining a supportive approach, because I've seen how significant it is with these patients. I mean, don't get me wrong, I've been supportive of my other patients with mental health disorders that I've talked with over the years, but those who are battling a substance and having issues with sobriety is very important to also maintain that supportive approach and focus on strengthening the way I guess, strengthening the way I see myself as their support system. Us in the medical field, we are also part of the support system. I will continue to use motivational interviewing. I feel like since we started working on that, I've been able to use it a little bit more in this last week, and it's been helpful with some patients. Some I don't really feel like they kind of picked up on it, but some I do. Like this particular patient with the alcohol use disorder, I feel like he was able to motivate himself in some ways, but he did at times go back to the sobriety that he was battling. And that's about it. Thank you.